The new device enhances existing gamble appraisal instruments for cardiovascular breakdown by tackling the force of AI, ML, and computerized reasoning, artificial intelligence, to decide patient explicit dangers of creating horrible results with cardiovascular breakdown. Cardiovascular breakdown is a dynamic condition that influences personal satisfaction as well as amount to. All cardiovascular breakdown patients are not something similar. Every patient is on a range along the continuum of hazard of experiencing unfavorable results, said specialist Zulu Mazimba, MD, a cardiovascular breakdown master. Recognizing the level of chance for every patient vows to assist clinicians with fitting treatments to further develop results. About cardiovascular breakdown. Cardiovascular breakdown happens when the heart can't siphon sufficient blood for the body's necessities. This can prompt weariness, shortcoming, enlarged legs and feet and, at last, demise. Cardiovascular breakdown is a moderate condition, so clinicians must have the option to recognize patients at chance of unfavorable results. Further, cardiovascular breakdown is a developing issue. In excess of 6 million Americans as of now have heart disappointment, and that number is supposed to increment to an excess of 8 million by 2030. The UVA analysts fostered their new model, called CARNA, to further develop care for these patients. Tracking down better approaches to further develop care for patients across Virginia and past is a critical part of UVA Wellbeing's very first 10-year brilliant course of action. The scientists fostered their model utilizing anonymized information drawn from great many patients signed up for cardiovascular breakdown clinical preliminaries recently supported by the public foundations of Wellbeing's Public Heart, Lung, and Blood Organization. Scrutinizing the model, they tracked down it beated existing indicators for deciding how an expansive range of patients would toll in regions like the requirement for heart medical procedure or relocate, the gamble of rehospitalization, and the gamble of death. The scientists trace the model's prosperity to the utilization of ML/artificial intelligence and the consideration of hemodynamic clinical information, which depict how blood circles through the heart, lungs, and the remainder of the body. This model presents an advancement since it ingests complex arrangements of information and can make choices even among absent and clashing elements, said analyst Josephine Light, of the College of Virginia School of Designing's branch of software engineering. It is truly energizing on the grounds that the model insightfully presents and sums up risk factors lessening choice trouble so clinicians can rapidly pursue treatment choices. By utilizing the model, specialists will be better prepared to customize care to individual patients, assisting them with living longer, better lives, the scientists trust. The cooperative examination climate at the College of Virginia made this work conceivable by uniting specialists in cardiovascular breakdown, software engineering, information science and measurements, said specialist Kenneth Bilchik, MD, a cardiologist at UVA Wellbeing. Multidisciplinary biomedical research that coordinates gifted PC researchers like Josephine Light with specialists in clinical medication will be basic to assisting our patients with profiting from man-made intelligence before long and many years.